All right, you're an oncologist. You've had a number of patents. You study cancer as a matter of your professional pursuits. You understand this disease as well as anybody we could find, and that's why we asked you to come on here. Look, prostate cancer is one of the easiest cancers to detect. You can take a PSA test. Everybody knows it if you're over 40. Sir, I just don't believe that an 82-year-old man suddenly found out that he had stage 4 prostate cancer that had metastasized to his bones. That didn't happen in the last 100 or 200 days, now did it?
Well, it didn't. And to be specific, I mean, strange things do happen, but it's in the 1% to 2% range. So 98% of the time, this kind of cancer will have been present for about 5 to 7 years. Easily detectable, as you say, with a blood test, PSA, easily detectable with a digital rectal exam. He's going to have symptoms getting up at night to urinate and other sorts of things. So it's highly likely that while he was campaigning and during his entire tenure as president, he had prostate cancer. Interesting speculation is whether he was being treated for it during that time. One of the major treatments is called ADT, or androgen deprivation therapy, blocks testosterone. Two major side effects are cognitive decline and falling down. So almost 40%. Say that again. I want you to take a moment here, doctor. I want to circle that. The cure or the treatment for prostate cancer results in side effects. I want you to say that slowly and for great effect. Go again, please. Okay. So which testosterone is driving the prostate cancer. You want to block testosterone. When you block testosterone, lots of things happen in other parts of the body other than the cancer. One of them is you lose muscle mass, you lose ability, you become more frail. 40% of the men who will take it for a year will fall down because they're no longer able to just walk in normally. Second is it has cognitive effects because testosterone is a hormone that affects the brain, and so you will have cognitive decline in a highly statistically significant fashion. So part of my speculation is that maybe we were seeing side effects of prostate cancer treatment during this last presidency.
I can recall a number of times that Joe Biden fell. He fell on the stairs of Air Force One multiple times. He fell off a stationary bicycle. He fell at a military graduation ceremony, and those are just the ones that come to mind. He began shuffling, a shuffling gait to prevent falling. The dementia became much more pronounced over the last couple of years. I guess it would be your hypothesis, doctor, and I do not want to put words in your mouth, but based on what you've said here, the hypothesis would be that he was being treated with testosterone blockers to help control the cancer in the prostate or that disease from spreading worse, and he was suffering because of it. That's what I'm gaining from this.
Yeah, I mean, as you say, it is raw speculation, but I think the American people deserve to know, and these are the kind of questions we should ask, because, repeating myself now, but yeah, both falls and cognitive decline are side effects of the treatment for prostate cancer.
Yeah, I repeat myself often. That's a side effect of getting older, but it's not a side effect of this. Let me ask you this, professional opinion, as an oncologist, as a man who's dedicated his entire professional career to patents and pursuits of curing cancer. Your professional opinion, and I know you can't make a diagnosis of someone you've not met personally, however, best guess, did he know that he had cancer prior to the 2020 election?
I think it's probably greater than 80% probability that he did, because, again, it would be, if you flip it around, it's sort of malpractice to not do a blood test, to not do a rectal exam in a man who's going to run for president, who's going to be, have the nuclear football and be responsible for many things in this country. It's one of the simplest things to look for. Prostate cancer is one of the most common cancers, so it would be malpractice not to do it, and then you tell the patient, and then the patient decides what to do with that information, of course.